Cancorla. Minister, I'd like to begin by acknowledging this catastrophic report that is out and commend you on insisting that this happened and that the research was done and that we got a real, I suppose, drill down to the detail of where this is at, where the system's at. We've all known for years that there are difficulties, there are problems, but there's some really stark and frightening outcomes in that report. As you know, Minister, I have on many occasions raised with you the issue of mental health, both with adolescents and children and with older people, adults will say. And I firmly believe, and I hate to admit it, but I firmly believe that within CHO1 and particularly within Cavan Monaghan, we have one of the highest rates of suicide in the country. And I'm going to take this opportunity, Minister, to yet again plead with you to deliver Jigsaw within Cavan Monaghan. I know you have made huge inroads in delivering a service within CAMS in Cavan Monaghan. But the reason I ask for Jigsaw specifically is because I think that visibility, that recognition is hugely important. And we talk about teleservices or teletherapies for young people. I still really believe in that face-to-face contact. We do know that services are available at the end of the phone. However, we also equally know that when people are at their darkest moment, that's just too late. It is just too late. This Christmas and New Year, I have to tell you, Minister, I have never seen anything like it in Cavan Monaghan. There has been a huge loss of life, and particularly for young people, because of suicide. And as you know, Minister, I have campaigned for a long time for the scan nurses. And just allow me to compose myself, so I'm sorry. I would say that I'm very grateful to you for the delivery of the scan nurses. That's something I hugely believe in, and that's the suicide crisis awareness nurses. And they are very effective. We've seen they've worked, and we're seeing they're a huge component part of mental health services. And I just want to wish the two nurses who have taken up those roles within CHO1 the very best in their very important roles, in their very significant roles, because I believe they can have a profound impact on the lives of people who find themselves in a very dark place. I think everybody around the House has been able to give experiences within their own constituency offices, and I want to take this opportunity because it's great to have this opportunity to speak frankly and openly with you. But one experience that I can give you, Minister, is of a 15-year-old girl who desperately was crying out for help. She had the presence of mind to tell her parents she needed help, to tell her social workers she needed help, to tell them within her school she needed help. But she had to fight with the system to get the help. And when I say fight, her parents shouldn't need to ring a TD to say, we need your help. This child needs intervention. She needs the specialised care. She needs a bed. But they did. And when I rang her school with the agreement of her parents and her community around her, just to find out how much on the radar of the school she was. In a school of 500 children, she is in the top 5. The school can recognise she's in the top 5 at risk. Yet to get the help, the professional help she wanted and knew she needed, she had to fight for it. That shouldn't be the case. It just shouldn't be the case. It shouldn't need to come. I was more than happy to help her. And I would have to say, when I did make the calls that were necessary, she did get the help. But she was at the end. Actually, when the family rang me, they said, I never rang a TD before. I'm sure it's not something you can help with. Thankfully, I was able to help. But she shouldn't need it. I would also make the point, and when we have this opportunity, in Cavan Monaghan, we don't have the residential care and services that's required for children and adolescents. When children find themselves in that position, and adolescents find themselves in that position, they end up in clinical care alongside adults. And it just isn't right. It just isn't right. That particular girl did get a bed in Lindara, very grateful for that bed in Lindara, and they could certainly provide the care that she needed. And I am so glad to tell you, Minister, that because of that specialised care, that young girl is around today to tell that story. But she would be the first to admit herself, and her parents would be, had she not got that care and got that intervention, that might not be the case. That's only one example, Minister. I suppose all of us have endless amounts of examples of the type of crises and particular cases that we've heard. And I just suppose I'd like to just join with all the voices, and your own included in that, to concur that I suppose ultimately what's needed here is oversight and accountability. And we've heard many times tonight that recruitment is an issue, and we know recruitment is an issue within the HSE. And I would ask the question, Minister, don't Corú have a part to play in all this? In terms of, I am very much aware of staff, of professionals who wanted to come in within the system, within the HSE, and have had to wait 9 to 12 months just to make the cut and get through the paperwork and the nonsense that goes on with bureaucracy to get on the panel, to be part of the system, to take up the positions that they're more than qualified for. So I would ask, Minister, the question, can Corú, they have to be part of the solution. They have to be. I'm going to finish with this, Minister, and that is the case of Dan Hogan. And he's not a young person that I knew. I know his brother Rory Hogan, but his mother again spoke very openly, very honestly on drive time this week. And I was driving to the constituency when I heard her interview on with Cormac O'Hara. Elaine Clear gave the most harrowing account of what happened to her son. He went into mental health services at the age of 13 and he died at 17. And what upsets her most, this is 8 years ago, and what upsets her most when she hears what we're talking about, when she hears these debates, when she reads that report, she is just crippled by the thought that nothing has changed, that nothing has changed. And in her interview that she gave on drive time, I mean, you would just have to stop the car. You'd stop in your tracks when you would hear what the experience that she had from he was 13 until he lost his life at 17, what they went through to try and get him the help, what they went through to try and get him the services. And this was her experience. When they did get him into the clinical care and he was brought to the clinician that was looking after him, the clinician gave his father the option. You either sign him in to a service that she would describe as a prison, where the doors were locked. He went through 5 locked doors to get to the room that he was going to be cared for in. That the father either signed him in or they would get a court order to sign him in. And his mother felt she did not want him in his adult life to have a record. So therefore she agreed to sign him in. No phones, no parent was allowed to stay with him. It's bizarre that that would be the case. When would you ever be asked to leave your child? When would you ever be asked to do that? And to leave them when they're in those kind of deep, dark, hollow, black places that we can't even imagine, to be told you can't stay with your child, you can't sit with them. She would have given anything to stay the night with him. Herself and her husband and her brother would have rotated it. They wanted to be with him. They weren't allowed. They were locked out of his care. And she said eventually her son got a phone somehow, or perhaps he wasn't allowed phones, contact or anything like that, but he got a phone and he was whispering on the phone like he was in prison saying, "Ma'am, please come and take me out, collect me, please get me out of here." And she has to live with that now. Live with that. It has to be acknowledged, of course, there's great people there. They're under huge pressure. And I know, Minister, that mental health service, and particularly CAMHS, is obviously in very good hands. I know you lead this with your heart as much as your head. So I would just like to support you in any way I can to do the work that you're doing. Thank you.